Hi everyone. Today I'm here to talk to you about my research topic, which is the awareness of cardiomyopathies among college-age students. As a little bit of an introduction, cardiomyopathy is present in society now more than ever due to the COVID-19 pandemic. Takotsubo syndrome is a form of stress cardiomyopathy whose numbers have greatly increased since the beginning of the pandemic. Cardiomyopathy is also an unexpected side effect in adolescents and young adults from the mRNA COVID vaccine, which is why it's important to gather more information about cardiomyopathies among this age group. For those who don't know, cardiomyopathy is a disease of the heart muscle, making it harder to pump blood throughout the body. And in my study, awareness refers to a general understanding or knowledge of the topic and an understanding of the implications of diagnosis. Currently, there is a lack of research specifically about cardiomyopathies. Most of the research that is conducted is about heart disease, which is an overarching term and can consist of many different conditions, not just cardiomyopathies. There's also minimal research about the connection between COVID and cardiomyopathies. Little to no studies investigating cardiomyopathies among college-age students are present, which is why my study can come and fill this need. Current studies are also outdated and may not accurately reflect society today. Most studies are from the 1990s and early 2000s, and technology and medicine have advanced greatly and rapidly since this time, which might make certain results from those studies inadequate and not completely accurate. A literature review of one study from 2004 is about coronary heart disease risk factors in college students. In this study, they screened college-age students between the ages of 18 to 24 for risk factors for coronary heart disease. One reason why they targeted this age group specifically was because early detection is a crucial step in slowing this disease's progression. Some of the findings from the study included that more than half of young adults had at least one risk factor for this disease. And one reason for this is that they proposed is that students in this age group tend to experience a significant decline in diet quality, especially when they're going to college and cooking for themselves for the first time. Most young adults are also not screened, which is why they believe they were unaware of these different risk factors. Another study looked at the awareness of heart diseases among female college students. And in order to do this, they distributed a cross-sectional survey to female students from a Catholic university in South Texas. In this study, 1/3 of the 320 female students that were surveyed believed breast cancer was the greatest problem facing women, and half recognized that cardiovascular disease was the leading cause of death in women. An interesting aspect to this was that younger students were less likely to recognize this than older students, and there was also significant ethnic differences in the perceptions of risk. The purpose of my study is to gauge the level of knowledge about cardiomyopathies among this susceptible group. This includes their knowledge about different risk factors, what lifestyle decisions they can make, as well as their willingness to learn about the condition as a whole. I also want to understand how heart disease is perceived in relation to other health conditions, such as which college-age students believed is the greatest health risk for them, what causes death the most among this age group, as well as which they feel most informed about. In addition, I want to assess the need for educational intervention regarding heart health, such as implementing programs and diagnostic testing centers on college campuses and universities. Some research questions for this topic include: what habits do college-age students partake in that increase the risk for cardiomyopathy? How much information do college-age individuals know about cardiomyopathies, and how do they learn about this condition? How are cardiomyopathies and heart disease perceived by this group compared to other health conditions, as well as what firsthand experience does this group have with heart conditions and preventative measures? The general propositions for this study is that poor health habits, as well as a lack of personal experience, will lead to low levels of knowledge about cardiomyopathies among college-age students. In order to test this, a cross-sectional survey of students will be distributed using the snowball sampling technique, and the survey data will be stored on Qualtrics. In this study, independent variables include health habits and a lack of personal experience. The dependent variable is the level of knowledge they have about cardiomyopathies, and different moderator variables include age, gender, and major. The survey will start off with general health questions and will funnel down to heart conditions specifically. At the end, it'll target cardiomyopathy questions to see how much level of awareness they really have. The survey will contain different components such as multiple choice questions, as well as 5-point Likert scale questions. Some preliminary findings from this study: 150 UMass students were able to complete this survey because they were enrolled on the University of Massachusetts Amherst, as well as they agreed to the terms of the study. Of those 150 students, 44% were between the ages of 18 and 20, and 56% were over the age of 21 or 21 years old. 37% of respondents were male and 63% were female, and 9 of the 10 schools on campus were represented. The only school not represented was the School of Agriculture. Some general health findings from this early data is that slightly less than 1/3 of respondents had no aerobic or strength exercise routines, and the majority of respondents consumed 4+ alcoholic beverages per sitting. An interesting fact is that while they are consuming alcohol at large quantities, roughly 70% of respondents do not use tobacco or any tobacco-related products. In terms of heart conditions, only 13% believe that heart conditions were the greatest health risk for someone their age, and the topics they did feel most knowledgeable about were cancer and alcoholism, which they felt 40% responded with cancer being the greatest area they knew the most about, followed by alcoholism with 37%. Respondents also selected high cholesterol, high blood pressure, and genetics as the 3 greatest risk factors for heart disease in someone their age. Some cardiomyopathy specific findings were that 75% of respondents had not read any information about cardiomyopathy in the past 12 months and had never discussed cardiomyopathy with their primary care physician. When asked if they understood what it meant to have a cardiomyopathy, 48% also selected that they strongly disagreed with the statement. Proper descriptive analysis will be applied to the survey results using SPSS and Excel in order to expand on these results in order to draw on different conclusions and recommendations, and appropriate statistical representations will be included in the analysis. In terms of these contributions, I hope that I will be able to increase the overall body of knowledge and to help fill knowledge gaps, as well as highlight the need for educational intervention and inspire self-reflection on those who took the survey and may feel like they are lacking certain knowledge they want to know. Thank you for your time, and I hope you have found this topic interesting just as I have.